So I met Dr. Lane about 10 years ago, and at the time I was leaving another practice and looking to start my own practice, and he had a building that was kind of for sale, and so I met him to look at that. I started talking to him, and I actually bought the building, or started to, and then he said, what are you going to do in the meantime? And so I said, I don't know, and he said, well, why don't you come and work for me, and just until you get this building ready. And so I did, and he put me in some offices that I liked a lot, and I, got busy immediately and met a lot of nice people, and, so that was supposed to last for about 3 months, and I was there for about 6 years. Then I started my own practice here, and I had it for almost 4 years, and then we kind of hooked back up together again, and so it's been a really good thing, I think, for both of us. So I'm a general dentist by training, but I've done a lot of extra training in cosmetics and TMJ. So I end up doing a lot of those kind of cases. I still do all the regular general dentistry things, but we see a lot of TMJ patients and cosmetic patients, and I enjoy really doing both of those. So working here at Lane and Associates, the kind of neat thing is, I have a really close relationship with Dr. Lane, and so it's really a very open communication directly with him. I don't know that it's that way in other places. If there's something that I need to get the job done better, I get it. If there's extra training that I want to do that I think is going to serve our patients better, I get that. It's really important to me that it's run by a dentist. Dr. Lane is a great dentist and a good guy, and so he makes decisions, patient care decisions as a dentist, because he is a dentist, and so that's kind of one of the things that makes it really nice. So the one thing I think, and that I missed when I had my own practice, is, within our group we have really everything covered. We have oral surgeons, periodontists, endodontists, general dentists, TMJ, not specialists, but so you can come here, and within our group you can get anything that you really need done. And geographically we have a pretty big footprint too. We cover a lot of ground. There's a lot of if somebody moves, they can typically stay within one of our offices, get all their information transferred, and still be kind of in the family. Wow, right close by, I'd have to say Winston's, and it's just predictably fantastic. Oh wow, that's a tough question. I'd rather just get what I want and clean them afterwards. So it does. There's a lot of sugar in sweet tea, and also, you do kind of run a risk of staining your teeth from the tea. But like anything else, people do it, so it's important. Not if you love it, have it, but then you just have to be pretty diligent about cleaning things afterwards. Yeah, so it's interesting. I got into TMJ almost kind of by accident. I was looking to learn more and more about cosmetics, and I went and studied at the Las Vegas Institute in Las Vegas, Nevada. And they taught us all about the cosmetics, but really what they taught us most importantly was how people's teeth got to be in such shape and how to treat the underlying cause of that, of bite disease and things like that. What I found out was there's a whole sort of realm of untreated people that wouldn't even know to come and look for a dentist to help them. They've been to neurologists, and I saw a patient the other day that was getting ready to have surgery, and it would have been the worst thing for him to do. A fairly aggressive surgery that may or may not have helped them, but it's really, really rewarding to be able to help these folks and kind of give them most of their life back, their quality of life and things like that. And we get a chance to do that every day, so it's really it's a pretty neat thing to be able to do. Yeah, so it's a good question. The main things people think about coming to the dentist is when they start to have popping and clicking when they open and close their jaw. But what's more kind of out there is we see a lot of patients that don't have that, but they have persistent migraine headaches, neck and shoulder pain, ringing in their ears, tingling in their fingertips, or weakness in their hands. And sometimes, most times, there are things that we can help with, if not completely eliminate.